I was on a date, got in a hot tub, never been in a hot tub before, and had never fainted before, and I have low blood pressure, which I've always had, and I was anemic at the time, but I didn't know that. I stayed in the hot tub too long, and when I stood up, I remember saying I felt really funny, but I didn't realize I was about to faint. And I think according to what Tom was his name, according to what Tom told me was, I just stood up and like my eyes closed, and then I face planted on tile because I think I fainted standing up. I was out for about 2 minutes, he said, called 911, but I hit my chin and that pushed my jaw back, and blood, teeth, everywhere. It was a mess. Yeah, I lost 10 teeth and my jaw shattered in many places, and the joints were totally shattered. They ended up disintegrating. They just couldn't repair themselves. I was wired shut for 6 weeks. But he, I don't think, was convinced that my jaw was going to fully repair on its own, which it didn't. The temporal mandibular joint replacement surgery on both sides of my mouth. Well, for the first 6 months, I guess he wanted, does the bone grow and attach to the metal? All right, I was up there once a week, and he didn't want me to do anything. I pretty much still slurped food, and I was really swollen, and the whole left side of my face was paralyzed. They had to tape my eyes shut so I could sleep because I couldn't blink. One of my complaints was, and one of the times I went back to him, that my mouth got so tired of trying to eat. And he said, I think you need somebody to help you, a physical therapist, to help you with your jaw muscles. He said, because you can only do this. They called it chomping. You can't grind your food because your jaw, the metal, keeps you from doing this. And so he said there's not too many people in southwest part of Florida that do this, but he recommended 2. One was you and one was Dr. Ralph. And he said they were both at Allied Physical Therapy. And I said, where's that? He said,
how far did you drive to come to your appointments?
An hour and a half, on a good day.
Wow. Okay. A little bit about...
Well, when I first came here, my jaw muscles, I was having such a hard time eating because every time I tried to chew, even soft stuff, they would knot up. And I just couldn't make them work, and I called it catch, I would be like, they're not moving right, So then I came up here, and when Dr. Raphael checked me over, he could feel all the knots, more on my left, because that was the worst side than my right. And so then I was coming twice a week for 4 months, and he was working my jaw. So I did the exercises. I mean, he did what you just did with the thumbs, and then he holds it here, and I try to go up, and he holds it here, and I try to go down. And we keep that muscle going. And that has helped me to be able to eat. But I mean, I still have to eat the right kind of foods. He, with his hands and thumbs, he loosened my muscles. And then he used pressure to help me learn to use those muscles and to give them, I guess the stamina, I guess is the word I'm looking for, so that I can chew for a while. And then he gave me that jaw mobility tool that I use faithfully every day, because that really makes you work at, strengthening those muscles so they don't get knotted up. Well, I can eat without being in pain. That's a joy. I mean, I still have to always do soft and little, but at least I can eat those things without being in agony. I mean, I used to quit eating, which isn't good because I'm not a big person, but I just couldn't stand it. So I can eat now, as long as I eat the right foods. So and he educated me and kept explaining, why I can only chomp instead of grind, and I have to keep those muscles working. And he also wanted me to work on my core, and like you were doing the neck stretching exercises, because where they cut me, it's tight, you know. And then, so I'm a good student, you know, I follow the rules. Well, I think Allied's been great. I mean, it's a long drive for me, that part I don't like, but you know, that I don't have any control over that. But everybody's been very nice, very helpful. They always greet me when I come in and, you know, check me in, and very attentive. And the people that I've worked with seem to know exactly what they're doing. I mean, quite often Dr. Raphael did the jaw stuff, and then when he wanted me to do core stuff, he gave me to an assistant or whatever, but they knew the exercises and showed me how to do them. Everybody's been friendly and helpful and seemed very knowledgeable. Yeah, it's a nice location because it's not surrounded by concrete structures. You've got grass and water, and you've got a little sitting area outside and big windows. It's open and bright, which is nice. Doesn't feel dirty or dingy or anything like that. No, it's comfortable. You have to keep doing it. You have to keep going after it. And even though it gets hard, and even though I sit down and cry sometimes, you've got to keep doing it. And it's helpful to have somebody like Allied to help you along that journey, because I was at a point where I was so frustrated. You know, the surgery's done, my teeth, my implants are in, and now I'm still not being able to eat. So I was stuck, and I mean, I feel like Allied pulled me out of that and kept me going, and now I understand about the muscles and how I have to keep them exercising, increase their stamina, and keep them working. You know, if you don't work it, it gets rusty, and then it doesn't work. And that's what Allied's been good for.